Welcome, everybody. Great to have so many of you joining us today. Tim, if you would happily share this slides, that would be brilliant. I'm Jan Burkhardt, former director of the JUMP programme and now in a role around sharing learning from the work of the local delivery pilots. So just to give a brief overview, I'm going to start by talking a bit about the journey with Active Bradford.
There's like a little collection of trigs in the Lake District.
Can you possibly mute? Somebody's not on mute.
Hello? Again, I think you're right, Nicole. That like
Anthony, you need to mute. Thank you. And then going to pass over to Tim to talk in more depth about the strategy and how we've aligned to the health system. And finally, I'm going to pass to James Brown to talk about where Active Bradford is now and how it's also working with the health system. Great. Next slide, please. So the start of the journey, Active Bradford is our physical activity partnership for the Bradford district. And it was formed in 2013. It was a kind of loose partnership for networking and sort of basically bringing partners together. It had some influential members involved. You know, we had leadership from public health, from the CCG, from major sports organisations, universities. But the strategy was still a kind of very traditional physical activity strategy with more of a focus on sports and recreation. In 2017, Active Bradford bid for the Sport England local delivery pilot and was successful. And it became a company limited by guarantee as part of that process. However, it didn't really have the governance in place to manage the scale of the funding for JUMP phase. So it was actually the JUMP phase of the local delivery pilot was led by Born in Bradford, which is a research institute, which is quite an unusual setup. So JUMP, for those of you who are not aware, I think most of you may well be, was our Bradford local delivery pilot, and it was really focused on testing and learning a whole system place-based approach to making a step change in children's physical activity levels. And that 5-year programme was highly evaluated, including a control trial, which showed a 70-minute per week improvement in physical activity levels of the children in the JUMP area compared to children outside of the JUMP area. And having studied the international research, this is actually the biggest health improvement around physical activity that's been seen globally on a population level study. So we're very proud of what was achieved in Bradford, and we have a resource hub which will share the contact with in the chat, so you can find out more about JUMP. But today we're going to focus on 2 of the 14 work streams that made up the JUMP programme, and that is embedding physical activity in policy and the strategic influencing piece. So we were starting this work in 2020, which was at the height of the pandemic, as you'll remember, with COVID. It's obviously a very challenging time for bringing together particularly public health partners and health partners because they were immersed in dealing with a global pandemic. However, we did manage to form a small physical activity strategy working group, and that group started off with a mapping exercise. Next slide, please. So our first sort of focus was we looked at the academic research about what were the policy areas that could impact on tackling inactivity. And the research shows there are 10 key areas that can make a difference. So we started looking at what policies we had in Bradford and where physical activity was physically written into those strategies. It was quite a sort of light level because you're just saying, is physical activity mentioned, written? We didn't manage to dig into, is it being implemented? And you can see here the bullseye, at the centre of the bullseye is where physical activity was found to be well embedded in those policies. And as you move out, by the outer ring, it wasn't embedded at all. And we had an immediate quick win off of that one, which was that children and young people's and family strategy didn't mention physical activity, but was focused very much on obesity. And they were actually in a strategy refresh process, and we worked with them to help them understand that physical activity, while it contributes to obesity, has a much wider health and social impact. And so in the new refreshed plan, physical activity was a standalone priority, meeting multiple outcomes. So that was a great starting point for this piece of work. Off the back of this piece of work, we realised that the partners we were struggling to reach were often in transport and planning and urban design, parks and green spaces, the ones that were maybe more peripheral. Next slide, please. So we took quite a lot of time to, oh, Tim, can you just move? Yeah, thanks, yeah. We spent quite a lot of time really reaching out to those partners who were very busy people, didn't have much capacity, but we invited them to take part in 2 co-production workshops. These were half-day workshops to bring together all of the partners across the system to co-design a physical activity strategy with a whole system approach. And Tim will say more about that soon. They were really well attended. We had over 110 partners attend. It was a half day. We took a very collaborative approach to it, really trying to connect people up and build relationships. And by the end of that, we reached a point where we had priorities in place across the system. We did a piece of research around this, and you can see the link there to the article looking at this partnership approach to embedding physical activity in policy. And the findings from the evaluation were that it helped to build a shared understanding of the importance of physical activity. It developed shared responsibility for taking action, and it built that connectivity and relationships for that long-term journey of actually delivering the strategy. So that was the findings from the beginning. Next slide, please. And this is kind of very high level where we got to at this point, which was that we identified 9 areas, thematic areas we called them. And within that, each of them had priorities for action. And I'm going to hand over to Tim at this point to tell you a bit more about the next steps and how the strategy, the heart of the strategy, what it's about. So over to Tim.
Great, thanks very much, Jan. Yeah, hi everyone, and great to see you all. So as Divine said at the beginning, my name is Tim Howells. I pick up what is called our Healthy Communities team within public health in Bradford. And I guess following on nicely from what Janet just mentioned, we touched on this kind of co-production process. It took a number of years. I'm going to kind of just pick up on the broader consultation work that we did. I'll touch on the actual strategy itself, the implementation group that kind of leads and directs the strategy, the link to health, and particularly around our kind of shared work with NHS on obesity. And then I'll touch on governance as we go through. So just to kind of, I suppose, follow up on what Janet mentioned, is that we, as part of the kind of co-production piece for the strategy, we did a huge amount of work engaging with families face-to-face across the district. And that was really to try and get a much more representative sample of people's contributions towards what physical activity means to them, and how do we, what do we do? Where do we go? Who do we influence? And effectively, what does it look like for our district? Most of this is pretty much bread and butter stuff that most of you will had experience on before. But I think it was just to reflect on the breadth of what we did as part of this kind of co-production, and the fact that we linked it quite closely with the same period of developing our food strategy as well. So there was this kind of a huge amount of kind of outreach into communities and with communities. From the physical activity side, probably none of it was overly surprising, but just to reflect on a few of those points, is that these were the main things that came back out of our kind of co-production work and have helped shape the strategic or thematic priorities for the strategy. And that's the piece around green space, around the work we do in parks, safety being a key factor, the focus on children and young people, with Bradford being one of the youngest local authorities in the country, the focus on accessibility support, and on workplace health. So again, none of it was particularly surprising, but it has all helped shape our approach and the kind of the thematic priorities. So as Jan said, we've got our strategy. It's the Every Move Counts strategy, and it has these 9 key thematic areas, all of which are kind of led and delivered by our physical activity strategy implementation group. And that implementation group is a really kind of interactive space. It's kind of a co-ownership space where we have thematic leads from across the system, different organizations, different partners that kind of own those particular areas, be it the health and social care piece is owned and led by the colleagues in the NHS, and active travel is led by our colleagues in transport. And we have a kind of really, I think, fairly effective model of this kind of co-ownership towards delivering the strategy. And each of those thematic leads takes responsibility for updating the action plan on a quarterly basis, attending our monthly meetings, and helping contribute from their team, their department, their organisation's perspective into what is effectively our whole system's approach to physical activity. Probably just worth highlighting two bits that I've put on in bold on this slide, and that was the work around the built environment and the impact that we've had around our relationship with sort of the planning team and the local authority, and how the strategies helped influence some of those much bigger decisions that have been taken over the past few years in the local authority, and I'll touch on that in a second. And then there's a bit of this nuance in terms, and if you ever do read our strategy and you ever kind of want to look at it in any more detail, you'll notice a nuance in some of our terminology, and that is that we've got this additional focus on sedentary behaviour. And it is important to recognise that the strategy isn't just about how do we get people more active, and also not just about how do we prevent people from being inactive, but actually it's also about how do we tackle sedentary behaviour, and what we also classify as non-exercise activity thermogenesis. So in other words, it's the people that are, it's the time that we spend static, not moving, and neat, as it were, is that kind of piece around how do we get people walking more for stuff that isn't actually exercise or physical activity. So whether that's walking to the shops, whether it's gardening, or whether it's simply just moving more at home or in the office and sitting down less. So it's a core part of our strategy. And this was the bit around where public health has become much more integrated, intertwined in the strategy because of the implications it has on health. And it was also recognizing that over the last decade, physical activity levels, or inactivity levels, haven't changed. So yes, we've made some strides nationally of increasing our numbers of people that are physically active, but actually we haven't really made any impact on those that are inactive. So over the past 10 years, the statistics and data hasn't changed in a statistically significant way. So we still have about a quarter of our population that are classified as physically inactive. And it was a recognizing that actually from a health perspective, the biggest impact that we have from a public health perspective is actually those people. It's the kind of sedentary part. It's the how do we kind of shift and grow the non-exercise activity thermogenesis part of the spectrum. And those of you that have done this work already and are highly immersed in it, you'll recognize the attached graphic around the kind of dose response curve, and recognizing that actually the biggest impact to health and health benefits comes from that bit right at the beginning, that sedentary behaviour piece. So it was just to recognise that why we've integrated it into part of our strategy, and that it is an integral part of, Active Bradford's vision. And the data that I put at the bottom, it's probably about 10 years out of date now, I think, but it was just sort of reflecting on the fact that sedentary behaviour is an independent risk factor to physical activity or inactivity. It's about 11% of deaths in the UK are from sedentary behaviour on its own. So it's just recognising the importance of this as part of our kind of vision and mission to helping support the district. And it was that bit around what is the role of public health and health and care. Now, I touched on built environment and their role here. Any of you that have been to Bradford recently or have been kind of watching any national news, you'll know that our city centre has gone through massive redevelopment, and it's this kind of piece around pedestrianising a huge part of our middle part of the city, going from a much more roads, cars centric to a model that really prioritises walking, it prioritises cycling, And it prioritises that piece around sedentary behaviour and non-exercise activity thermogenesis, which I talked about. So it's getting people more active without them realising that they're more active, getting them walking more around the city centre. It's a safer place to be, it's a cleaner space to be, and it's just a nicer environment. And actually, if any of you have been to the district, you'll notice it has, made a huge difference. And just from an air quality perspective, it's made a big difference. So we know that this work, alongside our low emissions zone that the district has, it has meant that of the 36 areas in the district that were breaching EU regulations for poor air, that's now down to just 2 areas. So there's been huge strides, and this piece of work particularly has shown that interconnection across improving our communities, improving the environment, which had a knock-on impact on how people are physically active, how people move across urban areas, and in cleaning up our air. And that has had a direct impact on asthma admissions to hospital and cardiac episodes to hospital. So there's been some fantastic benefits of this kind of integrated working across the local authority. So like I said, we do have this sort of separate physical activity action plan. And the reason that we have this separate plan and separate delivery group is it makes it easier for us to define what we mean as our whole systems approach. It gives us that chance to get that kind of better ownership and accountability across different parts of the system, so that people feel that they're contributing towards it. It's not just owned by Active Bradford, it's not just owned by public health or the council. It's a much more integrated mechanism of ownership and reporting. And like Jan said earlier, it's not just about obesity. So we also recognise that physical activity is its own public health topic in itself. It's a part of the causal map, but actually it's much broader than that. And we've been trying to, we talk about that kind of parity of esteem from a mental health perspective and how we embed mental health across pathways and provision, but actually physical activity is also, it provides that kind of cross-cutting theme. So the next few my slides will just be specifically on the integration with health and what is effectively our whole systems approach to obesity and well-being. And probably will come at contrast to what I've just said around it's not just obesity, but actually our interconnection in health, and from a public health perspective, has been mostly about the link to obesity. And that is because it's such a priority area in the district, and I'll come on to that in a second. So some of you will know that in Bradford we have Living Well, and Living Well is our whole systems approach to obesity and well-being for all ages, for all people, for all of the district. And it's been around for nearly 10 years now, and we worked with Public Health, what was Public Health England, to produce Living Well as a kind of gold standard of whole systems working. And it evolved over the past probably 6 or 7 years through COVID, and it's much broader. So it's not just about our mechanism of tackling obesity, but it's our mechanism of engaging with people to improve health and well-being. And over the past 12 months or so, because of rapid and recent policy changes, new national guidance, NICE guidance, GLP-1s and weight medication, it's also gone through its own evolution and redevelopment and refresh. So we spent a lot of time making sure that it's fit for purpose and it's integrated in that kind of system working. This one is a bit of a busy slide, but I thought I'd just include it just to give you an idea of the breadth of what Living Well is and what it attempts to do. It's integrated across all levels of, the kind of social determinants of health. We've got work that specifically focuses on engaging with individuals and individual service provision, work around supporting communities and organisations, plus then the kind of physical environment and how we influence planning and policy and the kind of environment piece. So it's just recognising the breadth of what Living Well is. And what I would say here is just there's this kind of key integration of how we've tried to merge physical activity and obesity as a vital piece of local policy. So in Bradford, and probably not too dissimilar to the rest of the country, obesity is still our second biggest killer, preventative killer to smoking. It costs the Bradford district nearly, well, it's forecast to cost our district nearly £500 million per year by 2035. Our research tells us that it's about 300 million as we currently speak. Now, to the NHS nationally, that's about 10 billion forecasted by 2050. So we have a huge economic impact of obesity and societal cost. It has an impact on growth and GDP. And the way that we're able to integrate it as a priority for the district is this piece around economic development and economic growth. It is demonstrating the impact that it has on things like productism, absenteeism, and just the impact it has on society and communities. We also look at this from a kind of a wraparound supports perspective. So we know that people that are accessing weight management medication get fairly robust wraparound support from the NHS, but they don't necessarily get it if they access medications privately. So there's a role here around how physical activity is embedded here to help support those communities and those people that are accessing the medication that may be at risk of, bone density loss and falls prevention in older adults and muscle loss. So there's this kind of integrated piece here. It's also recognising that obesity is heavily integrated in the NHS long-term plan. Most of you that have read the plan will see that the NHS is committing to this moonshot in tackling obesity. Physical activity is barely mentioned in the long-term plan, but obesity is a core function, is a core integrated piece of the long-term plan. So we've just tried to be, clever in how we navigate it, how we frame it, and how we integrate it across the NHS. And we also have this integrated and shared governance model, which I'm just going to touch on a little bit more detail. So Living Well itself has what we call sociocracy. So we've adopted a sociocratic approach to governance. And for those academics amongst us, you'll know that this is a kind of horizontal mechanism of governance working in complicated whole systems. So instead of saying we own the system, instead of saying we're in this very vertical mechanism of governance as what usually happens, we actually are an integrated part of a complicated system. Each component part of obesity, so be it biology or society or mental health or psychology or physical activity, each has its own whole systems way of working and governance already. So it's recognizing that we are integrated within that. And our new mechanism that we've adopted is this kind of values-based governance to provide better ownership, accountability, and oversight within the district. Physical activity being a key part of this shared model. And Active Bradford is an integrated part of the Living Well governance, and the Living Well is integrated part of the Active Bradford governance. So you have this shared accountability and ownership. And it makes it a much more flexible and collaborative way of kind of ownership, as it were, but in a complicated system. So physical activity, like I just said, we have this dual accountability, dual reporting. So Living Well provides some level of engagement and oversight from a governance perspective, but as does Active Bradford. And we have this dual accountability, dual reporting. And eventually, yes, all roads will lead to the wellbeing board, but it provides us a much more coherent and consistent approach of this kind of shared ownership across the council, across health, across public health. So last two slides from me before I hand over to James was just to say that, there's challenges to overcome and some general work around how we frame physical activity. I've talked about economic growth, the ongoing challenges around how we get that kind of buy-in across local authorities, and particularly with austerity and the lack of budgets, etc. I put here it's a trap. I think there's a tendency we quite often fall into the arm of saying, oh, let's just set up more provision instead of focusing on this, what I call the dominant environment with that transformative change. And we can only do that with having robust whole systems working that is integrated and has this shared accountability and ownership. And just making sure that we don't have too many chefs, as it were, and making sure that the action plan is a tangible plan that has that kind of integrated ownership across the system. So last slide from me was just to say, what lessons have we learned and what has contributed towards local success. I think you've probably got the picture from Jan and myself that co-production has been a fundamental piece, and ongoing co-production is a fundamental piece of our work. I think it's important to recognise that we're not necessarily doing a whole systems approach, but actually we're doing systems thinking and systems doing. And it's recognising that we all operate in this really complicated system, and we're not trying to own it per se. And a lot of the stuff we try and do is outside of our control. So actually we're doing systems working. And as with a lot of stuff that happens in health, particularly physical activity, food, mental health, etc., we can't all be system leaders. Actually, what we do is with system diplomats, the role of this kind of integrated way of working is that we are trying to operate in a complex system, facilitate and coordinate this kind of messy environment that we work in. Getting right level of political buy-in is really important, and I won't dwell on that point in any further, because things have changed, particularly in Bradford around our political environment, and it has been important for us to work with our elected members and get that kind of buy-in to support the importance of embedding physical activity at every opportunity. Communicating, celebrating success, it goes without saying that we need to do a better job of shouting about the good stuff that's happening, and events like this are a good way of us sharing the learning and being that kind of asset-based way of working and promoting the good stuff that does happen. And finally, just finish by saying that that kind of shared governance and establishing shared governance early is super important to be able to get that ownership across what is a complicated area of work. So I'll hand it over to James.
Thank you, Tim. Afternoon, everyone. Hope you're enjoying your lunch if you're having it at the moment, and really nice to see some familiar faces. So I've only got a couple of slides. My kind of task really is just to bring you up to speed with where we are, where we're up to now. I'm kind of riding the wave of some of the previous kind of journey that people have been on, albeit involved in some capacity previously in previous role at Yorkshire Sport Foundation. But just to say, I'm the Chief Executive of Active Bradford, and been in post just over 5 months. So still doing a lot of listening, still doing a lot of learning, but absolutely fantastic place to be working, given all the work and the kind of relationships that are in place already across Bradford and wider. So I think just to update really that Active Bradford is now a charity, so a charitable company with kind of some of our own governance in place, and much of the implementation team that started off as the jump program and the local delivery pilot has transferred over to be employees of the charity now. That happened last summer, continuing the great work and the kind of investment and mandate from Sport England around that place partnership has really given us that kind of foundation to build on, alongside that brilliant work that Jan's kind of alluded to, and all the resources you can see in the research that came from the jump program. But where we are now, and what's really important to kind of focus on from what's already been said, is we're a dedicated team at Active Bradford, kind of almost independent with that kind of separate governance, because we're there to really help support practical action around how we can create the conditions for the active lives across all those different elements of the strategy for the district. So we're moving, and we're in a transition period from the real focus on children, young people in really specific geographical neighbourhood areas, which absolutely we're going to continue in terms of the kind of inactivity and the inequalities piece, linking to Marmot's proportionate universalism approaches, and that's absolutely central to where we're going to continue to work. But actually, how are we also able to support the kind of growing work of a district-wide plan for children and young people in terms of the physical activity that kind of Jan alluded to early on, and also across all age groups linked to the Every Move Counts strategy? Because I suppose I'd say we're kind of guardians almost of the strategy. We aren't the organisation on our own who is going to deliver that. It's absolutely the approach that's kind of been alluded to. And the reason I like this slide, and I know it's quite busy, and it's something that a lady called Ingrid Burkett kind of put in one of their briefings, and the next slide will be as well, which I'll come on to in a sec. But I think it's really important to focus on there's specific governance that we're looking for around those organising structures and processes that help support the shared outcomes and the collective impact that we're all looking for. So it's that dedicated independent team to have the time and the inclination and effort and kind of advocacy on behalf of the system to have those conversations, because we know collaboration's really difficult, right? And it's really difficult to align resources. It's really difficult to guide that kind of vision and strategy when people are getting kind of absolutely kind of buffeted left, right, and centre with their own investments, with their own political standing, with their own kind of outcomes and outputs that people are looking for across those different either parts of the council or parts of the system in terms of the NHS or the hospital trust and others. So it's having that dedicated resource that can be independent around the place partnership and being able to have the time and the space to influence and advocate on behalf of physical activity that will really drive the collective impact. So just two to pick out here in terms of kind of the resourcing. So how are we able to, as the small core team supporting the rest of the system, kind of support that mobilizing of resources, whether that's Sport England, whether that's local authority, whether that's kind of other investments coming into Bradford, such as the Nature Towns and Cities investment that's coming through Sarah Alley and the transport and the kind of Natural England team. How are we making best use of that in terms of not duplicating, in terms of having the best outcomes for the communities? How are we making sure community voice is absolutely central to what gets delivered in certain neighbourhoods, because we know where that's included in terms of co-production, like Tim's touched on, that's when we get the best outcomes in terms of the ownership and other things. So it's resourcing, but I don't see it as just resourcing from a kind of organisational perspective. It's absolutely having the right governance to resource and getting the investment where it's needed the most. And that's different. And that will be different from place to place, but it's being open and honest about the conversations that would need to be had in each place to make the best use of that. So, for example, in Bradford, the consultants just working through the playing pitch strategy, the built facilities strategy, and a green and blue place strategy. And that's really critical in terms of the natural environment and the infrastructure and how that will give us the kind of foundation to build on when it comes to assets in the area, and give us that direction linked into the local plan, which is absolutely central to then the regeneration and housing and all the other things that we know are really crucial. And it's our role, and my role on the team, is to help influence that and kind of lever those conversations. The next point just to pull out is the authority bit, and Tim's kind of touched on it. So there's governance almost of the strategy, but also from my perspective of the organisation we are now, there's shared governance in terms of our kind of trustees. So we operate a model where Active Bradford as an organisation is a membership organisation. So members are other organisations in Bradford, such as the council, such as the hospital trust, such as the university, and all the ones that kind of Jan's touched on, the big sports organisations, the Hate Crime Alliance, other smaller charities. And actually our kind of articles of association, we're just kind of revising them slightly, but they say that actually 50% of our trustees have to come from member organisations. So it's really connected and rooted in the organisation to the local, the kind of local population, the local organisations that are in place in Bradford. You know, we don't want to go fully that way, so at least 25% have to be independents or the equivalent of kind of NEDs. But that gives us that real balance of being rooted in Bradford for Bradford as an organisation. It gives us the ability to do the things that we need to do. So they were the two examples really to pull from that. But a really good, it's a really good slide for me that keeps me on the kind of straight and narrow in terms of what I need to be doing from a governance perspective, and something to keep in mind with our trustees as well. Next slide, please, Tim. And again, this is someone else that came from Ingrid Burkett, and she's worked for an Australian and done a lot of work in terms of system thinking. And for me, just really, really great example to help visualize some of what goes on in my head, but also kind of the role of what the kind of Active Bradford organisation, but the system, really important back to that collective impact in the system, is how we pull together the kind of some of the individual work, whether it's individual programs, investments, whether it's kind of influence, and see it through the lens of Active Bradford and partners, and the partnership, the place partnership that kind of Sport England are kind of pushing for in terms of their national strategy, which has been absolutely crucial to help support this, to make sure we have things connected in a way that gives us that alignment of individual priorities, resources, programs, initiatives, understanding of the political environment. And it was just a really good way to kind of visually see what I kind of believe our role to be and how we can pull that together across the partnerships. So we're still at the early stages of some of the transition. We're working through that. There's a lot of work going on behind the scenes, which can be hard sometimes because sometimes it's less visible kind of the relationship building, making sure you've got access and know the right people, the trust built between partners as we do things together, is all the crucial stuff that kind of going back 10 years ago when Jan talked about the development of the partnerships. We're only where we are now, having gone through some of that. And that's just a nod back to, to Sport England and the kind of the way we have to work in terms of systems thinking and some of the work Tim's alluded to. It takes time. It takes time for us to continue working together and understand how best to make use of each other's skill sets, roles and responsibilities, and understanding what that looks like. And really now, I think the opportunity, just for the last 5 minutes, because we want to keep some time for questions. I think giving some examples of how this work has actually started to seed some really specific changes in the health and care system. So there's a few to touch on that I'll just mention now, if that's okay. So I think firstly, a really good example of going full circle from Jan's first slide, where physical activity wasn't embedded at all in children and young people's strategy, whereas now we're working very, very closely with the Children's Trust, because Bradford's Children's Services is in a Children's Trust at the moment, and sport and physical activity is actually named in the prevention and early help strategy. So this is around how young people and families gain access to early help when things might not be going quite right for them. It's around how we can create a sport and physical activity pathway to change lives for young people, essentially. So there's a bit of a challenge there, but actually part of that work is linked into some wider work that I mentioned earlier around how do we know and how do we understand what kind of a universal service is, or what is available for young people across the whole district, and start to try and map that and try and understand that to best we can. It's kind of a never-ending journey, that one, but I think it's given us the opportunity to understand what's available for young people, what services might there be there, what organisations are working with young people, how are they using sport and physical activity. And once we get that, we're going to almost build up that knowledge, competency and understanding around which people and partners and providers are able to layer up the levels of support that's required around something called the Thrive model. And that's something that's been adopted through the Prevention Early Help team, which basically moves from where the early help team have conversations with individuals or do an assessment with a family. If there's a signposting element as the kind of baseline or as the foundation into activities just for kind of well-being or really simple opportunities to engage with other young people, right the way through to where families or young people need really significant help and support, whether that's kind of criminal justice system, whether that's help with drugs or alcohol misuse, it might be help around kind of prevention and capacity to carry knives. So all those kind of things that actually are really specific support services, but where sport and physical activity can be used within that setting as a tool to enable support for children and families. So that's one really good example, and where we're going to get to with that, hopefully. And it's really important to say this is working with voluntary community sector partners across the Alliance, and it's working with street games and many of the other local providers. This should lead to a commissioning framework being developed by the Children's Trust, which then allows investment and some sustainability for the providers at a local level who are absolutely providing these local, really important services. And it should help support a sustainable model for them delivering to the people who need it the most. So that's the crucial bit of what's the reason we're doing all this? It's to make sure we can embed things into the system further down the line in kind of years to come. But without doing this work, we wouldn't be able to show where the impact's being had and where we need to kind of intervene, if you like. So that's one. Second one is just around based on some of the relationships and links with Born in Bradford, particularly in the research and some of the links through health and care. There's work taking place through the paediatric diabetes team and the paediatric physio team. And this is using physical activity in two ways. So firstly, it's using physical activity and physical activity sessions as an engagement tool to help support children and families come and access the service in the first place. So it's taking it out of the hospital or taking it out of the clinical setting, putting the service into a sport or physical activity setting to attract the young people to then be able to go through the service and get the support they need from clinicians. So that's the first thing. The second thing is kind of the obvious one around embedding physical activity into treatment pathways is really useful because it helps introduce children and young people to being active. It helps some of the behaviour change principles around families and support, and it also gives them the access to some of the local opportunities that might be available. And that's where you have the clinical teams embedded within the providers and providers working together to give that support. So it's kind of a way to use it kind of in a dual mode and the use of physical activity going forward. It's a bit of a test case. We do need to make sure we build up we need to make sure we're building up some of the research and evidence against that, which is what we're doing with the Born in Bradford and the research team, just to see what that even looks like or what that means going forward. And the third one, just to quickly finish on, is some work we're doing through, it's kind of come through the Healthy Working Life, which is all around economic inactivity and the local team in Bradford, but it's linked into the multi-system rehabilitation team who are embedded through Airedale Hospital Trust, and they are looking at how they can host some of their services again into local community venues. Now, the sticking point with some of this has come from clearly there's usually a criteria from a clinical perspective of what's required in those venues to allow that to happen. So usually kind of a square footage requirement, or usually access to a sink or a physio plinth, which is the physio beds, or certain storage facilities that can make it a challenge for some local community venues and others to host those services. And what we're looking at, and just a conversation from a couple of days ago in Homewood with the Sutton Centre and Sam there, was they used to have a pulmonary rehabilitation scheme in that setting, and they were required to supply a kind of metal kind of wardrobe, if you like, or casing lockable to store oxygen in, and they were required to have a sink. Now, they were things that they had to try and find investment for or come across to allow that service to be embedded within their centre. They managed to do it because they found some sinks through the old, some of the old capital that came through the COVID pandemic in terms of access to some assets and other things. But it just opened up the conversation around, well, the small things around if we haven't got access to a plinth and the clinical services can't afford to pay for a different plinth that's in a different venue, when we're working and working through Sam Keithley and the VCS Alliance with the place provider partnership, which is some of the new model for the health structures that's kind of replacing or enhancing some of the work that was previously in place through the local ICB. Can we kind of advocate for a very small pot of capital kind of funding that can be drawn on by community organisations if we truly want to try and make that shift in the 10-year health plan to get community services in communities away from hospitals? Is there a little bit of help just to help kind of oil the wheels to allow us to do that, where people can suggest, right, we just need a portable sink that we could use in our venue and it costs X £100? Because it's those small things that make a massive difference that is perceived as the barriers that actually can make a massive difference if we just open those doors to be able to do that and share that resource and understand how we can make best use of it. So hopefully that's just a few examples of, absolutely we're learning as we go with some of these things. We need to make sure we're being able to tell the story. We need to be able to make sure we can feed in that back up to through the structures in the kind of place provider partnership and the VCS Alliance. But it's I suppose for me it's a sign of where we've got to based on the relationships, the understanding, and the roles and responsibilities from all the previous work that allow us to be in a position to support that in the first place. So I'll finish there, Jan, and I think it's back to you. But great to see everyone today.
Thank you. And just once again, thank you, James, for updating us on where we are with that. And obviously that last slide we put in the chat about the resource hub. So there is loads more information, and this webinar will be available. So if you want to share it wider, it'll be on our resource hub. I'll hand over though back to Divine for questions.
Thank you so much, Jan. Thank you, team and James. That's really useful and very insightful. So just to let you know as well, we will have a interactive workshop at 1 p.m. So if you want to join, there's a link on the chat. We've got one question. Is there a public-facing evidence base for the strategy?
Well, just to, Tim might want to add to this, but just to say the strategy when it was launched has the whole first section of it is really providing that evidence base and that rationale. The fact we drew on the World Health Organization Global Action Plan for Physical Activity, which had a very strong evidence base, as did JUMP, but also providing the stats. And that was that is public facing. It sits on the Active Bradford and the Living Well website. And at the launch point, we shared that on social media, and we shared that with all of the people that were part of the consultation. Tim, is there anything else you want to add to that?
No, I think that pretty much covers it. I think most of it's sat on our website, but there is probably wider stuff that we can share if that's useful for people.
Thanks.
Thank you. Any more questions for everyone? Like I said, if you want to join our workshop, feel free. So we've still got some slots available as well, and we can have more questions if you don't feel like asking it here. And we'll also have a feedback form, please, if you would mind to answer it while reading. So any more questions for everyone?
We hope that some of you will join our workshop. We've got about 10 or 11 people joining us, but do feel free if you spontaneously want to. Someone said they couldn't hear me too well. Can you hear me now?
Yeah.
Oh, good. I just was probably leaning back too far. But yeah, really, this is an experiment for us. We felt that maybe we wanted to have more of a sharing learning side with the workshop approach. So it's the first time we've done this. So obviously I hope you've enjoyed the webinar, but if you are joining us for the workshop, this is really a chance to be able to have a much more informal, wide-ranging conversation and also share what's been going on with your work and how you are experiencing embedding physical activity in policy and linking in with health and well-being, etc. So yeah, that's great. Thank you, Divine.
Thank you. Yeah, we've got just one comment from Anthony. He said, thanks. I'm interested mainly from a primary data collection perspective, whether there are overlaps with what a WYCA.
West Yorkshire Combined Authority. That is for those. We're told not to use the abbreviation because people are like, WICA? What?
Thank you.
Yeah.
Tim, can you help on that one at all? I'm just wondering if you are aware about any work that's going on across West Yorkshire around data, primary data collection, data sharing. I would think Born in Bradford are doing work in that space, and I'm really sorry to say that I'm not up to speed with what that would look like, but I wonder if, Tim, you have any thoughts?
Yeah, exactly that. I think Born in Bradford would be the best bet. And it might just be worth us picking that question up outside this, and we can link it up with relevant people.
That would be really good. Thanks, Tim.
Can I just jump in, Jen? I think there's a range of different things, Anthony, that's probably worth kind of linking to, and there'll be various different bits of data and sources, and I suppose the challenge is bringing it all together the best we can. I was just at a kind of what they called an evidence safari with the Bradford transport strategy just on Tuesday. So there's quite a lot of evidence and data being brought through that route. But then also there's linking to the kind of Prevention Early Help Board. There's a lot of the information through the Violence Reduction Unit and the Youth Endowment Fund linked into the Home Office and others. And there's the Healthy Working Lives data in terms of the economic and activity. So there's a whole range of different data sets that we can probably pull on, and part of our challenge is making sure we're kind of aware of a lot of them and being able to use them. So yeah, more than happy to have a separate conversation.
Amazing. Thank you.
Thanks a lot.